I'm Dr. Brys. Thank you so much for coming. I'm glad that there is a good mix of men and women, because certainly this is a problem for everybody. Obviously, classically, men are faced with the fact that they may lose some hair at some point in their life, but so are women. There is a myth out there that only men go bald and women do not, and that's not entirely true. Near total male pattern hair loss occurs only in men, but women can also lose their hair in a female pattern of hair loss, and that type of pattern never really goes into a total baldness as it can in men. Hair loss affects about 25% of men around the age of 25. Between the age of 40 and 49, about 50% of all men have lost some hair. And 66% of men over 60 are affected by hair loss. The same goes for women. 66% of women will face hair loss at some point in their life. 20% get affected in their 20s, 30% in their 30s and 40s, and 50% in their 50s. The most common type of hair loss that causes permanent hair loss is pattern hair loss or androgenetic hair loss. It can be male pattern hair loss or female pattern hair loss. But when you notice hair loss, you want to see a doctor, and I put myself up there because I'm a hair restoration surgeon and I see people with hair loss all the time. And the reason you want to see a doctor is there are other causes that must be excluded first. So when you see the doctor, we'll take an exam and we'll see if we can rule out any underlying medical condition, or if it is, or diagnose it just as pattern hair loss if that's what it is. Having an underlying disease does not necessarily mean that you can't do hair restoration. It just means that you may have to treat that underlying disease before you can pursue hair restoration surgery. Some of the other common causes of hair loss include, and I'll get into these in a little bit more detail, but they include the ones listed here: telogen and effluvium, metabolic or endocrine diseases, autoimmune diseases, some scalp conditions, excessive styling, and traction alopecia. So what are these? When you come in to see me, I'll do a history, an exam. I may order some lab tests, and I may or may not do a biopsy in order to make a diagnosis and determine what your treatment plan will be. Based on history alone, I can pretty much diagnose telogen effluvium. What this is hair loss 6 to 3 months after a stressful event, such as a pregnancy, a major surgery, drastic weight loss, or extreme stress. Some people also have this as a side effect from certain medications like antidepressants, beta blockers, or even NSAIDs or aspirin and Aleve. What happens is you shed large amounts of hair every day. They come out in clumps in your hands. And at the peak, it's really just coming out in clumps. And the reason for it is because of that stressful effect, the hair has shifted from its usual pattern of growing, resting, and falling out, and all the hairs have shifted into a resting stage, and they all fall out at the same time, and that's why you get clumps of hair out. So sometimes the only thing you can do is really just wait. If you were pregnant and you gave birth and you lost all your hair, there's really nothing you can do. You just have to let the hair grow back. If medication is the problem, then you may need to speak to your primary care doctor about changing medication or changing the dosage. And if it's stress related, then you have to do your best to try to reduce anxiety. Some of the metabolic diseases that can cause hair loss are usually diagnosed by getting some blood work, going to the lab. Women can have polycystic ovarian syndrome. This affects 5 million women in the United States. And it's a hormonal imbalance in which the ovaries produce too many male hormones. So as a result, women grow hair on their face, they may have irregular periods, get acne, they get cysts on their ovaries, they may become infertile, and they lose hair on their scalp. When I order some lab work, I usually test for these hormones, testosterone and the DHEAS hormone. And if that's the case, you may need to see a gynecologist, get you started on a birth control pill. Another option is to do spironolactone, which is a medication that blocks the male hormones. And the other thing that you can do is actually lose weight, because the more fat that you have, the more testosterone that you're actually producing, because fat has an enzyme that breaks down estrogen into a testosterone. So that can help too. An endocrine cause would be either hypo or hyperthyroidism. Hypothyroidism means having too little of the hormone. This can cause unexplained weight gain, fatigue, constipation, depression, difficulty concentration, sort of a slowing down of your metabolism. Your hair, your nails, and your skin may become brittle, and it can break more easily. This affects about 5% of the population in the US, but it's 10 times more frequent in women. Hyperthyroidism, or too much of the hormone, can also affect your hair loss because your metabolism is so fast, you're just not producing enough, you can't produce hair fast enough. Some of the other symptoms include weight loss, heart palpitations, nervousness, irritability, diarrhea, moist skin, muscle weakness, sort of looking like you're startled all the time. This is much less common than hypothyroidism and affects men and women about the same. This is treated by either treating the elevated levels of thyroid or replacing them by giving you more thyroid hormone. If you do this, you may actually halt the hair loss and get back to normal. Another common cause that's treatable is iron deficiency. Women who have heavy periods or don't eat enough iron-rich foods are candidates for this kind of problem. The symptoms of iron deficiency anemia include extreme fatigue, weakness, and pale skin. People can have headaches, difficulty concentrating, cold hands and feet, and hair loss. So I would order some lab work, again, ferritin and hematocrit, and then recommend that you do such things such as eat more foods that are rich in iron, such as beef, pork, fish, leafy greens, fortified cereals, and beans. And you also want to eat foods that have vitamin C in them because that helps you absorb your iron, okay? And a woman who is menstruating needs about 18 grams of iron a day, and one who isn't after her menopause needs about 8 milligrams. Another cause that's reversible or treatable is lupus. This is a chronic autoimmune disease where your own body attacks your healthy tissues. It affects about 1.5 million people in America, and it tends to strike women in their childbearing years. Symptoms are similar to some of the other ones: extreme fatigue, headaches, ulcers in their mouth, swollen joints. Typically people get a rash around on their face, called a butterfly rash. And people can get hair loss where the hair comes out in patches, as well as having a rash on their scalp. I do a test for autobodies and usually have to see a rheumatology consult and a dermatologist to help treat some of these things. Typically it's treated with immune suppressants such as steroids or prednisone. Another autoimmune disease is alopecia areata, and these are basically your own immune system attacks the hair follicles and gives you these patchy hair loss, and it occurs equally in both men and women. This happens to be a man. This is the one, I don't know if some of you saw The View recently, they talked about steroid injections for hair loss. This is pretty much the only one that can be treated with steroid injections to help halt the hair loss. We don't know why it happens, but it can be triggered by stress or an illness. And the alopecia areata can be either in patches, it can also be totalis, just affecting the total hair of the scalp, or universalities, meaning it affects your entire body. So you lose your armpit hair, your brows, your leg hair, and all that. And again, the things that you can do are the interlesional steroid injections, Minoxidil or Rogaine, and reducing your own stress. And we'll talk about the medications in a bit. Some of the scalp conditions that can affect hair loss include seborrheic dermatitis, or really dandruff that's very excessive, psoriasis, or a fungal infection such as ringworm. These scalp conditions make it very difficult for the hair to grow. This is the seborrheic dermatitis. It just causes the skin of the scalp to shed its skin very quickly, and you get these greasy yellow scales in your hair, and you notice it on your shoulders. And it's a result of a yeast, as well as hormonal changes and excess oil. Psoriasis is another autoimmune disease that causes you to have excessive skin cell turnover. You're just creating too much skin, and you get these thick plaques on the back of your head that can bleed, and this can prevent your hair from growing normally. And here's somebody with ringworm, which is a fungus that you can contract by touching somebody else with the disease or an animal with the disease. More common in kids. So pediatricians see this a lot. We as adults tend not to see it, but it does happen. You get these red patches on your scalp, and these can be treated. So when you see your doctor, you do a physical exam for this, maybe a fungal culture and a biopsy, and then you really just need to be treated with medications to treat these diseases. either a shampoo for the seborrheic dermatitis, light therapy for the psoriasis, or antifungals by mouth for the ringworm. Another problem that women more than men encounter is excessive styling. Over-treating your hair with straighteners, hair relaxers, permanent waving, frequent hair dyeing, and usually in a combination, can basically get your hair to fry out. This person came into me because she was panicking. She's losing all this hair on the top of her head. But really what's happening is it's just breaking right where her last hair dye job was at. So the hairs just break and fall out. And really the only thing you can do is to avoid using appliances that overheat your hair. Use your hair dryer in a cool or a lower setting. Minimize flat iron usage. You don't want to dye your hair any lighter or darker than 2 shades your natural color, because the more color change you want, the more chemicals you have to use in order to achieve that. And when you put in mousse or hair gel or hairspray, don't brush it after it dries, otherwise you'll just be breaking that hair. Another type of hairstyling that can cause hair loss is sort of the cornrows. It's just too much pressure. This constant tugging on the hair causes the hair follicles to die. This hair loss can be halted, and you can regrow your hair if you stop doing this early enough, but sometimes it can become actually permanent. Other random causes out there is compulsive pulling of your own hair. Just constantly pulling it can cause hair loss. Loose anagen syndrome is common in fair-haired individuals. Another one is where people lose hair on their temples, and they don't really know why that happens. And the scarring alopecia is like the one with the cornrows that I talked about, and it's really maybe from physical trauma like burns to the scalp that can cause a scarring, and so you don't grow hair through that area. The most common reason, again, is this androgenetic hair loss. Like I said before, it affects both men and women, but in a different kind of pattern. In men, they tend to get a receding hairline and the crown thins, as you can see on that picture. Women, on the other hand, sort of get a more diffuse hair loss all over. They tend to maintain their frontal hairline, but it tends to get thinner in the back. Here's how it's done in men. You start off nice and young, and then eventually it can lead to this total baldness down here. But most often you start seeing the receding hairline and the thinning in the crown. In women, on the other hand, it just starts off as diffuse thinning that can eventually get pretty extensive. Now, it's called androgenetic alopecia because it's caused both by genetics and androgens, or male hormones. The genetics can be inherited from both your mother and your father, and if both your parents had hair loss, you're more likely to have it. The genes that are involved in a man are actually a little different than the ones that are involved in a woman, and they're still figuring out how it works exactly in women. The hormones that are involved are usually the male hormones, the androgens. Testosterone gets broken down by 5-alpha reductase to create dihydrotestosterone, DHT. Dihydrotestosterone is what causes the hair follicles to become miniaturized. They become smaller, and they eventually stop growing, and you lose that hair follicle, and you no longer grow hair in that area. This only affects the hair follicles that are genetically predisposed. So in men, it tends to be the ones that are in the front, the receding hairline, and in the crown, and in women it tends to be the diffuse top of the head. The other things, just for your information, that dihydrotestosterone does is it gives men an enlarged prostate, it gets their hair on their back to grow, and in a fetus, it makes the baby boy fetus create a penis. The role of male hormones in females is not as clear-cut as it is in males, but there still certainly is an effect. Because the hormones are involved, athletes who abuse steroids can actually accelerate their hair loss because they're just adding more and more testosterone, which then gets broken down to dihydrotestosterone, and that affects the hair loss. Some of the other things that can promote hair loss is a severe illness, some medications, malnutrition, and vitamin deficiency. But wearing a hat, excessive shampooing, lack of blood flow, or clogged pores are not responsible. Those are all myths. Another myth that I wanted to address is this concept of vitamin deficiency. And I know I mentioned it on the prior slide saying that vitamin deficiency can add to this, but it's really only severe vitamin deficiency that can cause hair loss. And it's usually at that point associated with a debilitating disease or starvation. Let's say you go from eating your normal diet to eating an apple a day for a year. Okay? Vitamin deficiency is really never a cause of hair loss in people who are not severely ill or starved. And most people don't encounter such extreme conditions. So there are many hair loss scams that claim to treat hair loss with a vitamin product, but it actually does nothing to treat or slow down your hair loss, okay? And a lot of people who buy and use these products are not vitamin deficient. So you'll notice that you can take biotin, which is a vitamin B, zinc, and protein to help enhance your hair growth, but really you're most likely not deficient in any of these things. So what works for hair loss? Well, in the ancient times, some people put camel dung on their head. They thought that worked. Raw onion rubbed into the scalp. Eating hot chilies was thought to enhance hair growth, and rosemary oil. There have been undocumented claims of miracle cures for hair loss for many, many years, at least since the days of the patent medicine salesmen of the 19th century. It's only been recently that we have scientifically confirmed success of both surgical and medical hair restoration treatments. So these miracle cures that are out there don't really have much scientific basis behind them. There are no controlled trials of safety and efficacy. There are some over-the-counter treatments that may at some point get future approval by the FDA, but they haven't yet been studied in a large clinical study. And they tend to claim their effectiveness based on anecdotal sort of statements. Oh, I used this and it got better. So how do you know if that's what you see? Well, you can buy it and you can try it and see if it works for you. It doesn't mean you're spending money on it, and nobody's really guaranteeing that it will work. And if you see that really the only proof of its effectiveness is anecdotal, like a testimonial, be a little skeptical. It's not been scientifically proven to work, okay? The only things that have been shown to work are the few things that have been FDA approved because they've been tested in clinical trials. Any product that stimulates hair growth is a product that's very potent. It has a big potent physiologic effect. So it's unlikely that that doesn't have some sort of side effect. So when you see a product, so you first want to look at a product. Does it actually stimulate hair growth in a majority of the people who are using this product? And does it do so safely with minimal side effects? You want to be skeptical when you see a product advertising that fails to mention any side effects or claims that there are actually no side effects, or if it omits to recommend that you go see a doctor or to use this product under medical supervision. There's also this thing that there are some products that are hair thickeners and hair restorers. Some products are capable of making temporary chemical changes to the outside of the hair to cause it to get thicker. Each strand gets a little thicker, so it gives you a fuller head of hair effect. But they don't actually stimulate any hair growth. It's only a temporary cosmetic sort of change. They work and they can help with the overall impact, but they're not actually stimulating hair growth. So what works out there? Well, the only FDA approved medications out there is Minoxidil, which is Rogaine for men and women, and Finasteride or Propecia for men. Low energy laser has actually been FDA approved, and surgical treatments, which is what this gentleman had. He had some hair transplants. And the other thing that you can do, which is more old-fashioned, is actually scalp reductions. And we'll get into these into a little bit more detail. So Minoxidil was actually originally an antihypertensive or a blood pressure medication to decrease your blood pressure. It dilated your blood vessels, and it was noted to be a general hair stimulant. When people were taking it by mouth, they were growing hair everywhere. So it was then created to be a topical solution that you just put on your head and your hair grows where you want it. So let's say your brows are a little bit weak, you put a little bit on your brows and your brows will grow. It helps increase the length and the caliber of your hair. It has been studied to be effective mostly for people under the age of 40 and whose hair loss is fairly recent. If you're 80 and you've had hair loss since you were 20, it probably won't stimulate the hair growth, okay? It will also not affect your receding hairline. It doesn't actually cure baldness, and if you stop using this medication, the hair loss will resume within a few months, okay? And you'll get back to where you would have been had you not used it. It comes in 2 different strengths, 5% and 2%, and you apply it to your scalp twice a day. The woman should use the lower strength formula, mostly because you don't want to get the unnecessary side effects, which is facial hair growth. Men are okay with that, okay? You also don't want to use it if you're pregnant or nursing. Here's somebody who used Minoxidil, and you want to use it for at least 4 months and possibly up to a year before you even start noticing results. So there is definitely a sense of commitment. And once you commit, you may notice in the first month that you're actually losing hair, and that's okay. Just continue using it. The reason for that is the hair tends to shift into the same phase, the telogen effluvium that I spoke about earlier, and you may lose it and then it'll regrow. And this gentleman had actually a pretty good response. I think there's definitely a difference in the length of his hair from one side to the other, which affects what the before and after looks like. And here's a picture of a woman who was using it. And this was her own picture that she posted after 9 months of using it. Using more than the recommended dose of twice a day does not help get you faster or better results, but it just increases your chance of side effects. Most common side effects with this are an itchy scalp, dryness, scaling or flaking of the skin, and irritation and burning. And if that happens, well, you just have to stop using the medication, okay? Rogaine itself makes a foam, which is a little bit easier to use than if you try some of the generic brands that tend to be a little bit more oily. Propecia has been recommended for men. The reason I sort of went into the whole metabolism of the breakdown of testosterone into dihydrotestosterone by 5-alpha reductase is because of this medication. This medication is a 5-alpha reductase inhibitor, so it prevents the breakdown of testosterone into dihydrotestosterone. It was initially used in men for prostate hypertrophy because dihydrotestosterone also causes your prostate to grow. And so it was noted that these men's prostates were getting smaller and they were growing hair on their heads, which was good. And so Propecia is a slightly weaker version of the original medication that was used for prostate hypertrophy, and it stops the dihydrotestosterone from working on the hair follicle and causing your hair to be miniaturized, okay? It stops the hair loss progression. It was found in studies to halt hair loss in about 42% of men. 48% of men actually saw regrowth of their hair based on a visual exam, just looking at somebody. And 66% of men actually regrew hair when it was measured under a microscope by counting the number of hairs in a small patch, okay? It does need to be used consistently and continuously for it to be and remain effective. So here's a picture of somebody. It is most effective in this crown area, is less effective in the front, and it's not at all effective in the temples on the side of the head. Here's somebody who had a hair transplant, but the hair transplant was from here and up, okay? And all this regrowth is just from Propecia. So like I said, if you stop the medicine, the results would stop, and you would lose the hair to a point where you would have been had you not started the treatment, okay? But this is not a sudden sort of hair loss from day to day, so if you skip a dose, it's okay. It really will take a couple of months to a year before you notice that you're losing the hair. Some of the side effects to this, less than 5% of people have some sort of a hypersensitivity to the medication. They get a rash or redness. It does affect testosterone, so some men can have testicular pain. 10% of men in the first couple of months of use have actually increased libido, and 1% of men have a decreased libido throughout the use of the product. If you stop the medication, you go back to where you were. Okay. There is a small percentage of men, less than 1%, who get erectile dysfunction, and there's a decrease in the amount of ejaculate. Because the hydrotestosterone does affect or promote the development of the male fetus, a woman who's potentially pregnant does not want to touch this medication, okay? And it's also why it's not recommended for women. So a woman who's pregnant shouldn't be handling the medication, but a man who's trying to get his wife pregnant can continue to take the medication because it's actually not found to be in the semen, so it's safe. He can certainly stop using it, but it's not necessary. The medication was tested on women, but because of this, it was only tested on postmenopausal women who couldn't be pregnant, and they found that there was no benefit to it. So, therefore, it's not recommended in women. 4-week supply, and this I just found on the internet, so I can't validate it very much, but it's around $60 a month. And it's usually not covered for insurance if you're using it for hair loss. I'm mentioning aldactone or spironolactone, which is a potassium-sparing diuretic, because it is one of the few medications that we can use for women that helps block androgens and inhibits testosterone. It's not FDA approved for its use on hair loss, but it has been shown to have some effect on women who have hair loss, especially and only under medical supervision. Men don't want to use this medication because it blocks your testosterone more broadly than the Propecia does, and you get sexual dysfunction and breast enlargement. Low-level laser energy was FDA approved. These kind of lasers just emit a kind of a cold light, and they're in the form of either a comb or a brush or even a cap that you can put on to use at home. Some professional offices actually have a hood that you can go into, and it's a little stronger than the at-home versions. And the effect of cold red light on hair growth was noted, but accidentally, in the 1960s when somebody was working on laboratory mice trying to treat cancer, and they were lasering the skin cancer with the laser, and they noted that, well, it wasn't killing the cancer, but it was causing hair to grow. So that's how that came about. It's a very narrow spectrum of light that's used, and this light is absorbed by the hair follicle, and it helps stimulate the hair growth by inducing a lot of the appropriate gene activity. It decreases the cell death, so it prevents your hair cells from dying, and overall enhances your cell activity and survival. But it doesn't work for everybody, and it works best when your hair loss is minimal to moderate, and it's more effective when it's used in addition to other therapies such as the Minoxidil or Finasteride, the Propecia, okay? But it may actually help induce hair growth and reduce inflammation after you have a hair transplant. It's also not a one-time treatment, which is why people tend to buy these at-home kind of gadgets where they can just read the newspaper or watch TV while they use it. You have to repeat it at certain intervals in order to maintain your hair growth. And it's only used for pattern hair loss. You can't use it for some of the other problems that I talked about, which is why you should see a doctor before you go ahead and obtain one of these from the internet. Hair transplantation is really the only permanent solution to hair loss. It has a high rate of success, and a majority of patients are very satisfied with the results, and both men and women are candidates for hair transplants. This gentleman had a hair transplant where the hair was taken from the back and transplanted to the front. Permanent results. And here's a woman who had some hair loss in the front actually, and she had hair transplants to have that treated. Hair transplants are great because they can make you feel better about yourself, you have more confidence about your appearance to others, you feel more sexually appealing, you look and feel younger, and you may be able to compete more effectively in business or in your own profession, okay, or whatever it is that your own reasons may be. Here's a young gentleman who was losing his hair when he was fairly young, and it was making him feel old. He got hair transplants, and he feels like he's back with his friends and feeling good. And here's somebody else, again a young guy, felt that the hair loss was making him look older than what he was, and the hair transplants made him feel better. So what happens with a hair transplant? Well, the hair follicles are transplanted from the back of the head. This is called the donor area, and this area in the back of the head is really not subject to the hair loss due to androgenetic alopecia. It's then moved to the recipient area, and the donor hairs retain the resistance to androgenetic alopecia in the new area. So they maintain to do what they would have done in the back of the head. So And they're also not rejected because it's your own tissue. So I can't transplant your wife's hair onto your head, but I can transplant your chest hair onto your head because it's still your own hair, okay? And that hair maintains its own characteristics, its color, its texture, its normal growth rate. All the genetics are within that hair follicle, and it just continues to do that. It's permanent. That hair follicle will not fall out, the one that I transplanted. But if more hairs in the front of your head were meant to fall out, they will continue to lose. So you may continue to lose some of the other hairs that are in that area or in the surrounding area, okay? And sort of you can predict how you will continue to lose your hair based on the degree of hair loss in your family members, the age at which your hair loss began, and how long you've been, and to what fashion you've been losing up to now. So depending on that, we may have to do more than one hair transplant session. The number of sessions that we do is based on how quickly you're losing your hair loss, how big of an area we want to treat, the number and size of your hair follicles that we want to use, how dense you want the hairs to be, and some other things. For example, somebody who has coarse hair, who's very curly, may need less hair transplant than somebody who has very fine, thin blonde hair. So here's a diagram of a gentleman who's feeling like he's balding in the front. A strip of hair is taken from the back of the scalp. That strip of hair is then cut up into individual hair units and transplanted into recipient sites in the front. And after a year or so, the hair grows. There's a couple of ways to obtain the hair for the hair transplant. The strip harvest is one of the most common ways to obtain a nice strip of hair, and leaves a linear scar in the back of the hair. This is usually very easily concealed by the hair above the scar, but it may be a concern for people who want to wear their hair very, very short. Most people have very minimal scars that are really not evident except when you're really looking underneath very closely. So when I'm taking a strip of hair, I prepare your scalp by taping your hair out of the way and cutting the strip into just a little shorter, because that makes the hair a little bit easier to handle. And then when I'm all done, there's the suture line that closes that strip that I've taken, okay? When you heal, there's that suture line, okay? The sutures get obviously taken away, and you really have to look very closely in order to see that scar. It's right there. It's a hairline scar, you know? I see some of you squinting at it. And then that strip of hair gets cut up into follicular units. Follicular units are your naturally occurring clusters of hair, and these can be either a single hair, 2 or 3 hairs, or 4 hairs, okay? And those are the ones that get then transplanted into the recipient, okay? So these groups of follicles, follicular unit grafts, are transplanted into the recipient area after I've taken away the fat. And that lets me put the grafts pretty closely together to give you a nice natural result. Obviously, I have to prepare your hair. Some people have a cowlick that they wish to maintain, and the way that you put these grafts determines how the hair will grow, whether it goes straight up or forward or whatnot. So there's a little bit of artistry involved. And here the grafts are being put in, okay? So you've got all these little tiny incisions, and here's one of those little hair grafts going into one of them. And here's somebody who had it done right after. She's got all those little hair grafts in that area, and there it is after about a year of hair growth. Another option of obtaining these follicular units is to do a follicular unit extraction. This means that you're avoiding the linear scar, but instead you have a scar at every single site that the hair graft has been taken from. And so you get these little dots that can sometimes get lighter or darker and be a little visible when your hair is cut very short. And the more grafts that I need to take, the scalp may start to appear sort of moth-eaten. In order to do this kind of a procedure, the hair must be shaved quite short in order to harvest them, and it's really a long, tedious process. So here's somebody before. This is the day of the procedure. This area was shaved, and then you can sort of see these dark holes. That's basically where a little punch, 2mm punch, took away one of the hairs. And about 5 days later, you can see that he's healing. You know, it's hard to find it, but you can see sort of that lightness in those areas. And imagine if you had to take away 2,000 hairs, how long it would take to take each individual hair and how many little scars you would have. So this type of process is significantly more laborious, and as a result, it's much more expensive. It can cost you at least twice as much to do it with the follicular unit extraction rather than with the strip technique. They do have robots these days that kind of do it for you, for the physician. But again, it's still extensive. It takes longer. You don't get as many grafts. But the benefit is that you can actually take hair from your chest and transplant it into your head. And you can also use this kind of procedure to take about 10-15 grafts or something like that and then transplant them into the hairline incision that you got from the strip harvest. So here's somebody, again, just another example of a before and an after from hair transplants. So these things work. Very naturally occurring results. I don't think you'd look at that picture and say that, you know, he looks like he had a hair transplant. It's very natural. Some things that really make it hard for me to offer a hair transplant to a patient is if you really don't have enough donor hair to carry out an appropriate amount of hair transplantation. And you'll be surprised how little it actually takes. But the key is to also have the patient have appropriate expectations. If somebody has unrealistic expectations that they want their hair transplants to just give them back all the hair that they had when they were 20, well, that may not be possible. I mean, here's an example. This gentleman, you know, he obviously has a pretty severe balding, but he's still a candidate. He still has enough hair. But I would never say that I would be able to offer him a complete hair restoration. So if he came in and said, "Doc, I want a full head of hair," I would never be able to do it, and I would never even proceed with it, because just to get to here might take 2 or 3 transplant sessions, because you're really only transplanting, that's a lot. 2,000 hairs is a lot of hairs to transplant at a session. A common question is whether or not these hair transplants are painful. And really, there's very little pain. We usually give you a little bit of oral sedation, some Valium, so you don't really care about what's going on, and then the scalp is anesthetized with some numbing agents like lidocaine. And then you don't feel anything after that. Once the medicine wears off, if it's during the procedure, then we may need to give you some more, and if we're done, then it's really very little pain. Most people can watch a movie, listen to music, or even take a nap during the procedure. It's pretty comfortable. You will get little scabs in the area where the grafts were placed, like I showed you before. If you have enough hair around the area, your own hair will kind of cover it up. You can shower and shampoo 24 hours after the procedure, and by keeping the scalp moist, these scabs will really disappear within 4 to 10 days. And usually you can leave the office after I do the procedure with a baseball cap on to cover your head. The stitch in the back of the head comes out. It's covered by your own hair immediately. If you're a female, you'll never even find it. If you're a male, your hair tends to be long enough to cover it up. Really, your hair needs to be about 1/2 inch in length in order to cover up the scar. And the sutures are removed 10 days after the surgery. You may want to take about 2 days off after this procedure just to recover. But depending on how big and extensive the procedure is, you may be able to go back to work the next day. But you don't want to run a marathon for at least 5 days after. You want to take it easy, okay? The hair that I graft will shed in 2 to 4 weeks, so you actually lose it. But the hair follicle remains, and you'll see new regrowth in about 3 to 4 months. And it'll continue to grow about 1/2 inch per month. Hair transplants are fairly expensive. They can range from about $5,000 to $8,000, but over the course of a lifetime, they may actually be cheaper than getting an artificial hair piece because of the constant maintenance that requires. So I think most people think it's a pretty good investment. There are some complications. The telogen effluvium, which is where people lose their hair, can happen. It's uncommon, but it can happen. Infections are very rare. The incision can break apart, again, very, very rare. Skin can die, very rare. Some people can have altered sensation because of the little incisions in their scalp, very rare. Bleeding is a possibility, but because we're really only going skin deep, it's not that big of an issue. So it really is a very, very safe procedure. There's this problem of graft burying where when you're doing the follicular unit extractions, taking those little individual hairs, instead of pulling it out, you actually bury it in, and it's very hard to get it out. And that's just specific to that type of procedure. If you have a tendency to get keloids or excessive scarring, that may be an issue for you, but to the general public, that's a very low percentage. Okay. So another great example of natural hair result. And here's a woman. She actually had a facelift, and she didn't like that her hair got moved up when she had the scar that was showing. So hair transplants were put in just to fill in that area. And here's another woman who had a similar problem. She had a scar from her hair transplant. I'm sorry, from her facelift, and so they got filled in with the hair transplants. And here's another gentleman. And you know, he's got the thick, kind of kinky kind of hair, and he needs less hair transplants than somebody like him in order to get the same effect, because they just take up more space. Now another an older way of treating baldness is really just to cut out the bald scalp. As a physician, I can do a multitude of designs in order to do that. Here's an example of a gentleman. He didn't like his bald spot. When you move his head, you can actually remove all that extra bald scalp. And here's him after 1, 2, 3 hair reductions. You can see that scar down the middle. And 4 hair reductions, and it's a pretty good effect, you know, so just lift up this way. And so there's him before and after, no hair transplants, just a scalp reduction. So it can work in the right individual.
What's his face look like? It has oriental lines.
Other options is, you know, the comb over. Giuliani did it for a while. Can do a wraparound. The jock look was popular too, just shaving it all off. Some people do hair pieces. This is a very acceptable option, but it does require secure attachment, and you do need to maintain it pretty much every month. So some people can have sort of a fear of being discovered when they use this. There are some camouflage agents that you can use as well. These are applied to the scalp or the hair to sort of give the appearance of fullness and then thinning. It sort of disguises the bald scalp underneath the thinning hair. And these are available in a variety of colors to match your own natural hair color. It's an acceptable short-term solution. So here's your hair before you apply these topic, and then when you put them on, it's supposed to thicken your hair, sort of like a tree branch. Here's before and an after of the product being used. The two that I come across often is the topic and the kabuki. They're available online and at stores. So sort of the overall hair restoration treatment can be a combination of treatments, both medical and laser and surgical, to give you your optimum results that fit your lifestyle at the current moment. If you are having hair loss, I do recommend you come in to see a hair restoration specialist to create a treatment plan for you. A lot of hair loss can actually be treatable. So, thank you.
Thank you.
Any questions? It's one of the phases of hair loss, and it's similar to the telogen effluvium, where it tends to get better. It tends to get better with time. Well, it's based on a history, and I may need to do a biopsy where the pathologist looks at the hair follicles, looks at the number of hair follicles in the different stages of growth that they may be.
Thank you.
You're welcome. It can, in the sense that that hair can all fall out, but it tends to grow back. You get that telogen effluvium, and it's a temporary hair loss. The way it's done, I try to avoid trauma to the existing hair follicles, and there's little scarring. These are very superficial incisions, and there isn't that much of a reaction. Even psoriasis, that picture that I showed you of the psoriatic patient, we've done it in psoriatic patients with good effect, and that scalp looks pretty aggravated, you know, but it's doable. So. For about 2 years, yeah. I do follicular unit transplants, meaning I take each individual hair unit, and I obtain that from a strip of hair that I take from the back of the head. So I do not do the follicular unit extractions for somebody with male pattern hair loss, just because it is very time consuming, and I don't think it's worth it to the patient. So I don't know what Bosley offers specifically. That's a big conglomerate. I think most people who are doing hair transplants these days are doing follicular unit transplants. There is this big debate of whether or not you do the little unit extractions or the strip, and I sort of gave you the two sides of the coin there. The more common problem that I've seen would be numbness to the scalp from the little incisions breaking the sensory nerves to the scalp. I haven't seen ongoing pain unless maybe they've had so many hair transplant sessions that their scalp is under a lot of tension from closing that incision in the back, from the excessive tension of the closure. It tends to get better. It may take up to a year for your scalp to resume its regular sensation. Really, within the first 3 months, you're back to where you were. It's not very common because, again, it's fairly. I don't know how aware you really are of your head, but from skin incisions, you may lose some sensitivity for the first 3 months up to a year. That's how long it can take to get it back. It used to be an older technique where we'd go really deep back here, and there are some big sensory nerves, the occipital nerves, that if you get some specific headaches, some people can actually get those nerves injected to get rid of their headaches. And by cutting those nerves, that would cause people a lot of issues, but we don't do that anymore. I do it in this building. I do it in my office downstairs. I have a procedure room. I get hair techs to come in to help cut the hairs, and pretty much spend the whole day together. You come in, I give you the medications to help you relax, and numb up the scalp. You're pretty much sleeping when I'm taking the hair strip, and I close that back up, and then I make all the specific holes, however many we talked about, and the areas that we're going to treat. For a woman, I would probably do the whole area. For a man, it may be more specific, and then we have lunch. You're awake, you have lunch, get back to it, finish putting in all the little grafts. Then you go back home the same day, and really most people do very well the next day. They feel like nothing happened. Well, most people benefit from one, and they may choose about 5 to 6 years later to do a second one as they've continued to progress in their hair loss. And that portion is really determined by what your hair pattern will be. By my discussion with you, if you tell me, oh, I lost my hair when I was 25 and I lost it until I was 35, and for the last 10 years it's been steady. Well, then I pretty much know you're probably not going to continue to lose hair, versus somebody who comes in, well, I started losing hair about 5 years ago and I'm still losing hair. That person will continue to lose hair. So, and I'll also ask you, well, what's your dad's head of hair look like? Oh, he's completely bald like a monk. That's slightly different than if you were to tell me that he has a full head of hair. It's both sides. It's both sides. Yeah, it's a wives' tale. It's both sides. They're still working out the exact genetics, but it's on both sides. Typical. A large session, which is anywhere above 1,200 grafts, is $7,700. Okay, $7,700, and anything smaller than that, between 500 and 1,000, it's 5,500, and then a small session. It is. We do have financing available. We use Care Credit, which is an outside external source company. I think they give you a 6-month no interest rate. So they're pretty good. They do most of the cosmetic surgery and hair restoration surgery. And I do also do the scalp reductions if you happen to be a candidate. Most women are not, but. That's a little bit more painful because you do feel that pulling of so that tension there. Scalp reduction, I just got my little cheat sheet. 2,300, 2,380, yeah. That's really just cutting out hair, you know, that probably takes about an hour and a half versus a hair transplant takes about 7 hours, so. It depends how big your scalp, the bald spot is, you know, so. It may be, yeah.
Okay,
Like that gentleman had 4,
Okay.
so. Absolutely, absolutely. For a lot of women, the hair consultations are really covered by your insurance. For men who want to just talk to me about hair transplants, it's a free consultation. So it's really, it's pretty easy either way. And the reason I do it through insurance for women is because they're more likely to need the lab work and the biopsies. And if you were to start paying that out of your own pocket, that would start costing you a lot of money. And so just charging it to your insurance company covers all that. If we had to go down that line, so. And then that would also help cover any medications. Okay. Because it's a tight line with insurance companies. You know, they may not cover the Propecia for men, but they may cover the spironolactone for women or the birth control pills or whatever it is. Okay. So, any other questions? No. Oh, as far as that's an all-inclusive price for that, yeah. And that is because it's done in my office, so I include the operating room fee in that charge. If we were to do a different kind of surgery that did require anesthesia, then that would be the additional fee of the operating room. Yes. Mm-hmm. Mm-hmm. It comes back exactly what it would have been like back there. Mm-hmm. Mm-hmm. So, you know, women pluck their brow hairs, and the hair that grows back is the same as it would have been. When it's scarred, then your own body's not producing hair in that area, sort of like the traction alopecia, or if you have a burn. But I can transplant hair into that area, and it'll continue to grow. Okay. Yeah. Because there's still blood supply to that scar. Otherwise, if there was no blood supply to the scar, the skin would be dead and black and necrotic. It'd be dead. But there is obviously some blood supply to that area, and when I transplant that hair graft, it just continues to grow. To stimulate? Probably not. Probably not. Because there's no follicle in that area to stimulate. Yeah, you don't generate new follicles with the laser. You can just stimulate them.